Dr. Bhattacharya, today in the Oval Office, HHS Secretary Robert F. Kennedy Jr. said, "We have this under control and we are not worried." I take it you agree?
I absolutely agree, Tony. The CDC team that's been managing it alongside the State Department and the rest of the government have been absolutely top notch. We have managed to bring the patients back home from the Canary Islands. They're now safely in the facility in Nebraska and a couple in Atlanta. It's an absolute professional organization.
You've come out yesterday to start talking about this. You're on tonight to talk about this. Why haven't we seen daily briefings on the Hantavirus the way we did around COVID?
You know, the epidemiological risk is very, very different. It is a more deadly disease if you get it, but unlike COVID, it's the way that people get it from person to person is much, much more difficult for that to happen. And so because the epidemiological pattern is different and the risk to the public is much, much lower, it didn't make sense to have a sort of a five-alarm fire bell. I'd love to have the conversation with you and with others just to make sure that the public understands where we are. But it's very different than COVID, and we should treat it differently than COVID.
On the subject of how it was treated, when was the CDC able to start planning for a response?
I mean, we've been tracking this for at least 3 weeks now, including there were 7 passengers on that boat, Americans, who came back and are now under close observation monitoring in various states. We've been collaborating with the local health departments and the state health departments, and also we've been providing technical advice to the WHO and to other governments on the response. So we've been tracking this for several weeks now.
Did you have to get permission, though, to launch a formal plan? And did you need to get a waiver to communicate directly with the WHO, which we're no longer a part of?
No, I mean, that's not, no, none of that was necessary. We withdrew formally from the WHO, which has to do with like our participation in voting for various things and also money that we give. But as far as technical cooperation with various aspects of the WHO, that's continued as usual. And in fact, the process of the withdrawal included a sort of like authorization for us to continue that technical cooperation.
Senate Minority Leader Chuck Schumer has claimed that the team at the CDC responsible for addressing outbreaks on cruise ships and other ships was laid off, fired. Is that true, and did that affect the response?
Well, you know, Tony, I've been the CDC acting director for about 2.5 months, and I've seen no gap at all in the group that manages outbreaks. They are among the most amazing people and professionals I've had in my career. I've had the opportunity to work with, and they've done an incredible job. I've seen, as someone who's been in public health my entire career, even before I became, came into the government. I mean, I've been very, very impressed.
Are there lessons from COVID that you're now applying to this outbreak in terms of the conversation, the way you communicate with the public?
Absolutely, Tony. I mean, I think the key thing is that we should be keeping the public aware of when there's actually threats to them, not causing the public to panic, not speculating about things that haven't happened or potentially, could in some universe happen, but and being very, very clear about what we know and don't know. And also by responding appropriately when there is a risk, just as we've done.
On the subject of preparedness, one thing we do know is the World Cup is coming to America, the Americas. It's going to be a massive event, millions of people traveling here. Is the U.S. prepared from an outbreak point of view?
Yes, the answer is yes. So the World Cup is an enormous event, and of course, anytime so many people are traveling, there's always the possibility of various outbreaks or whatnot to happen. But the risk is not any different than it is in other World Cups that we've managed properly. And the United States has systems in place to make sure that if something happens, that we respond appropriately.
Doctor, you say you're very pleased with the response. You haven't seen any lapses because of cutbacks. Are there areas, though, where you do wish there could be some change or improvement in HHS or CDC, in the public health response, in the conversation with the public? Take it as a big picture question.
Well, I do think you brought something up earlier, Tony, that I think is very, very important. I think after the COVID years, a lot of people have lost trust with public health, and frankly, with the CDC. I would love to find ways for the CDC to reconnect with the public, to reestablish itself in the minds of the public as the premier public health agency of the entire world, and that's something we have to earn. The response to the Andes virus outbreak is a marker point. You can see how well we protect the public from the risk, how well we manage the people that are in the facilities, how well and how professionally that the teams respond. That, I believe, will start to help reestablish the public trust in public health, some of which was lost during the pandemic, the COVID pandemic.
Dr. Bhattacharya, thank you very much.
Thank you.